APRETUDE is indicated for PrEP to reduce the risk of sexually acquired HIV-1 infection in adults and adolescents weighing at least 35 kilograms or 77 pounds who are at risk for HIV-1 acquisition. Individuals must have a negative HIV-1 test prior to initiating APRETUDE. Now we'll cover the important safety information for APRETUDE. Boxed warning: risk of drug resistance with use of APRETUDE for HIV-1 pre-exposure prophylaxis, PrEP, in undiagnosed HIV-1 infection. Individuals must be tested and confirmed to be HIV negative prior to starting PrEP with either oral or long-acting injectable cabotegravir and with each subsequent injection of APRETUDE. The test used to screen for HIV should be approved or cleared by the FDA for diagnosis of acute or primary HIV-1. Drug-resistant HIV variants have been identified with use of APRETUDE in the presence of undiagnosed infection. If a person becomes infected with HIV while receiving APRETUDE, they must transition to a complete HIV treatment regimen. APRETUDE is contraindicated in those with unknown or positive HIV status. Additionally, do not use APRETUDE in people who have had a hypersensitivity reaction to cabotegravir or in combination with the medicines listed on the slide. Now we'll cover the warnings and precautions. Use APRETUDE as part of a comprehensive prevention strategy that includes adherence to the administration schedule and safer sex practices. APRETUDE is not always effective in preventing HIV-1 acquisition. This slide outlines some but not all additional risk factors for HIV acquisition, including condomless sex, past or current STIs, self-identified HIV risk, having sexual partners of unknown HIV-1 status, or sexual activity in a high prevalence area or network. It is important to inform, counsel, and support individuals on the use of a comprehensive prevention strategy. APRETUDE should only be used in individuals who are confirmed to be HIV-1 negative, as previously highlighted in the boxed warning. Resistance substitutions may emerge in individuals with undiagnosed HIV-1 infection. Along with testing for HIV prior to initiation, seronegative individuals should be asked about potential exposure events in the preceding month and evaluated for current or recent signs or symptoms of acute HIV infection, such as those listed here. If recent exposures, defined as less than 1 month, to HIV-1 are suspected, or clinical symptoms consistent with acute HIV-1 infection are present, use a test approved or cleared by the FDA as an aid in the diagnosis of acute HIV-1 infection. This slide reiterates the importance of HIV testing prior to each APRETUDE injection and provides rationale for additional testing. Testing should be repeated upon diagnosis of any other STIs if an HIV test indicates possible infection or when symptoms of possible HIV infection are present following potential exposure. Remember that individuals who are confirmed to have HIV-1 infection must transition to a complete HIV-1 treatment. It is important to counsel individuals on the importance of adherence to the recommended dosing and testing schedule for APRETUDE. There is a potential risk of developing resistance to APRETUDE if an individual acquires HIV-1 either before, while taking, or following discontinuation of APRETUDE. This is why it's important to test before each injection to confirm negative status. For those wishing to discontinue APRETUDE, yet who remain at risk to HIV acquisition, alternative forms of PrEP should be considered, and, if used, started within 2 months of the final injection. Because of its long-acting nature, APRETUDE drug levels slowly decrease over 12 months or longer. Take this characteristic into consideration and carefully select individuals who agree to the every 2-month dosing schedule, because lack of adherence could lead to HIV acquisition and development of resistance. Serious or severe hypersensitivity reactions have been reported with APRETUDE, including Stevens-Johnson syndrome, toxic epidermal necrolysis. Discontinue APRETUDE immediately if signs or symptoms of hypersensitivity reactions develop. Clinical status, including liver transaminases, should be monitored and appropriate therapy initiated. Hepatotoxicity has been reported in a limited number of patients on cabotegravir, with or without pre-existing hepatic disease or identifiable risk factors. Hepatic monitoring should be considered. Discontinue APRETUDE if hepatotoxicity is suspected. Depressive disorders, including those listed, have been reported with APRETUDE. Promptly evaluate patients with depressive symptoms. The concomitant use of APRETUDE and other drugs may result in reduced drug concentration of APRETUDE. See the prescribing information for additional details. Consider the potential for drug interactions prior to and during use of and after discontinuation of APRETUDE. The most common adverse reaction occurring with APRETUDE was injection site reactions. The other most common adverse reactions with an incidence of at least 1% of all grades are listed in this slide. Please see full prescribing information for a list of potentially significant drug interactions. Use caution when using APRETUDE with drugs that can induce UGT1A1, as these may significantly decrease plasma concentrations of cabotegravir. When using APRETUDE in specific populations, consider the following. Assess the benefit-risk of using APRETUDE to the infant while breastfeeding due to the risk of adverse reactions and that the medicine may stay in the systemic circulation for up to 12 months or longer after discontinuation. When considering the use of APRETUDE with pediatric patients, remember that it is not recommended in individuals weighing less than 35 kilograms.